Hey guys, my name is Matt. I'm a student physical therapist at Nova Southeastern University. Today I'm shooting case study 3. This is my patient. Before I touch the patient, I'm going to ask for consent. Do I have your permission to touch you?
Yes.
Okay, great. So, to my understanding, you came into the clinic here and you have pain in your right hip that's radiating to the outside of your right knee. After manual muscle test, it revealed that you have difficulty doing this movement, which is called abduction, and also externally rotating the hip. You also have weakness as well. So that's the first thing I'm going to be working on today is strengthening those two things. So what you're going to do is, I'm going to show what we're doing first. I'm going to place this TheraBand on you. Okay, and once you stand, I'll be holding it from the side, but you're going to find your balance and you're going to kick out like this, okay? Slow and controlled. You're going to do this for 3 sets of 12 times, okay? All right, here we go. So for the sake of the clarity of being able to watch from the video, my patient is going to hang on to my shoulder while she kicks outward, just so you can see. Normally I'd have they can use the clinic table in front of them they can hold on to.
And that's 12?
Very good. So any pain or discomfort?
No, it's okay.
Okay, so if at any time that pain reaches, goes beyond the level of tolerance, we can go ahead and not use a resistance band at all, or we can do a gravity eliminated position laying on your back on the table, okay?
Okay.
So now we're gonna move over, we're gonna work on external rotation of the hip. Okay, so with this movement, you're actually gonna be bringing, here, move this over a little bit more, there you go. You're actually bringing the leg inward to externally rotate the hip, the right hip, okay? So what I'm gonna do is I'm gonna place this TheraBand on the inside of the ankle, and take your time, bring your leg all the way in, good, and back out. So once again, we're gonna do this for 3 sets of 12, good? Any pain or discomfort with this?
No, it feels okay.
Good. 6, good. 7,
That's 12.
8, good. 9, 10, good. 2 more, 11, and 12. Very good. Okay. All right. So now that's your strengthening. So what we're gonna do now is I'm gonna do a manual stretch. This one's called the piriformis stretch. Okay. This one you're actually gonna be laying down on your back. Very good. So what I'm gonna do now is I am going to have you bring your right ankle to your knee here. Very good. All right, like in the figure 4 position. And so what I'm going to do now is I'm actually going to help bring your leg up towards your chest. Okay?
Okay.
Ready? 1, 2, 3. Good. Try to keep this figure 4 position. Now I'm going to hold this for a total of 60 seconds. You should feel the stretch in your right lower buttocks.
I feel it.
Okay? So we're holding this stretch for 60 seconds. We're going to do this a total of 4 times. All right, very good. All right, so that's your stretch. So you're done with stretching and strengthening. Okay. So now I'm gonna show you a self stretch for what's called the IT band or iliotibial band. Okay. So you can just do what I do. Okay, you can stand on my right side. So what you're gonna do in order to stretch this right IT band, we're gonna place your left foot over your right foot. Make sure you're maintaining your balance. Okay, I want you to hike the right hip up in the air. Bring your arms in the air and go ahead and stretch towards your right side until you feel the stretch right here in the right hip. Very good. Once again, we're going to do this 4 times. We're going to hold for 60 seconds.
Okay.
All right, very good. Okay, so last but not least, I'm going to be showing you how to use a cane. Okay, so very quickly, here's the cane. Clearly this one can't really be adjusted. We're going to pretend that after standing, I would adjust this to your appropriate height by using your wrist with the olecranon process at the grip level of the hand grip, and also making sure your elbow's at a 30-degree bend once you're standing with that cane. Okay, so what I'm going to do, the ulnar process. So what I'm going to do now is once you stand, you're actually going to be placing the cane on your left side. Okay. Okay. So what's going to happen is try and place your hand in the cane hand grip at the handrest of the chair, and your other hand's like this on the other side. Go ahead and lean forward, feet about shoulder width, stand straight up, grab the cane to the height I was talking about with that 30-degree bend at the elbow, okay? And that will help bring your hip that's dropping upward, okay? So now when walking, it's going to look like this. You're going to walk with the cane. I want you to think of the cane and the right leg as one, okay? So you're going to step with the affected and the cane at the same time. Okay, once you do that, you will then step with the other foot to them. Later on, we'll progress to a step through. Okay, so let's give that a shot. Now, before you start, hold on, let me put your gait belt.
Okay.
Okay, so when you're ready, you can go ahead and stand up. Okay, so go ahead.
Okay.
Very good. So that's on good. Very good. All right. So what you're going to do is you're just going to take a few small steps. Stay within. Good. Very good. Very good. Very good. I'm just going to try to stay on your weaker side. Very good. All right. So that will conclude today's treatment session. What I'm going to do is I'm going to give you a home exercise program, and after I write what I saw today, the assessment, I'm going to go ahead and make some adjustments to either increase or decrease certain stretching or strengthening protocols that I have in mind for you. Okay?
Okay.
All right. Thank you.